All right, now we're going to talk about something that's maybe a little less well known than the music of Chicago. It's one of these things that sneaks up on people during their life slowly, but it's insidious, the effect they can have on your health. Dr. Nicholas LaHood is here today to talk to us about something called peripheral neuropathy. Big name, but it's got a pretty simple meaning, doesn't it?
That's right. It's damage to the nerve system, and it's a real serious complication that shows just how unhealthy those peripheral nerves can be.
Now, folks that have diabetes are real obvious examples of folks with neuropathy. It happens usually in their feet, correct?
That's right. It's a numbness or tingling sensation. Even it can go as severe as burning pain. It's the #1 complication for patients having type 1 and type 2 diabetes, but you don't have to have diabetes to develop peripheral neuropathy.
And the reason I say it sneaks up on people is because a little tingling, a little numbness, nobody thinks anything about that these days.
Right. And Mark, it's so dangerous because it starts out as a loss of sensation. That could lead to pressure points of people smacking down onto their feet, which can lead to trauma or micro traumas, which will eventually lead to an ulcer. And a neuropathy or neuropathic ulcer is the absolute most dangerous condition of this disease.
Does that end up being something that gets infected?
That's right. That's right. So what we do is we know that through research, stimulation, giving the nerves oxygen, and giving the nerves the proper nutrients are the best non-invasive way to treat this disease.
And again, we want to talk about, anytime we talk to Dr. LaHood and anybody in your group and the different conditions that you treat there, we talk about non-invasive treatments.
Right.
And this is, anybody can see that is the preferred way to go in the beginning. Certainly, if you can't help them, then you can go the next level, but you can help most people.
That's right. Especially if it's just starting, this neuropathy is just developing. Like I said, if you feel the numbness and tingling, you can also have this weakness or a shrinking of the muscles in your legs, like a loss of motor function. So we have put together a program that's extremely effective on not just combating the disease, but actually making improvements on reducing the patient's symptoms as they're progressing.
So the offer for folks today is you'd like them to just come in and see you, whether they've been diagnosed with neuropathy or not. But certainly if they have, that's a no-brainer. They come in and see you for 2 free visits, 2 free treatments. If they've got a little tingling or a little numbness, can you start to begin the diagnosis there?
So I'll do a very specific exam to test how much nerve damage the patient has. Based off their exam results, if there's no complications or contraindications, we'll definitely take them through those 2 sample treatments. We use a very gentle, safe electrical stimulating bath to stimulate those nerves. And of course we have those class 4 deep tissue lasers that we use. And the nerve needs oxygen. So if your feet are darkened or purpled or you see the broken blood vessels and veins, we use these lasers to open up the microcapillaries and bring in fresh blood flow to the area to help the nerves heal.
And this promotes healing. And again, that's the whole key, is the circulation. And these class 4 lasers, they increase healing by 4 to 5 times what the body would be able to do on its own.
It really opens up the blood flow to the area. So bringing fresh blood flow will bring nutrients, it'll bring oxygen, and those are the main components of what those nerves need. So if you have this sensory loss, if you have this motor loss, or one leg is skinnier than the other, definitely call the office and come in for a complimentary exam. There's no we'll see if this is an effective treatment for you.
So no obligation whatsoever, folks. It's an evaluation, but on top of the evaluation, you get to try 2 free treatments. And at the end of that time, then you can decide with the doctor whether to go forward or not. But certainly non-invasive, non-surgical, and absolutely free. There's absolutely no risk to you whatsoever to go in and see Dr. Nicholas LaHood. So it's great to see you. Thank you so much, and thanks for making the offer.
Thank you.
It affects a lot of folks. All right, for more information, you go to san diego6.com and you click on San Diego Living.